Let's talk about hemoglobin A1C, also known as glycated hemoglobin, and glycosylated hemoglobin.
The glycated hemoglobin test is important, in addition to other basic tests for diabetic patients, such as fasting blood sugar level test and postprandial blood sugar level test. It can be used to monitor the average blood sugar level for the past 2 to 3 months, since the lifespan of normal red cells is about 2 to 3 months.
We already talked about the cautions to measure glycated hemoglobin in our previous YouTube video. If viewers want to know the details of cautions to measure glycated hemoglobin, please visit our previous video called Checking Blood Sugar Level. What else? Could you remind me of the target range of glycated hemoglobin?
The American Diabetes Association describes the A1C levels for multiple conditions. Normal people have an A1C level of less than 5.7%. Pre-diabetic patients usually have an A1C level of 5.7% to 6.4%. Diabetic patients tend to have an A1C level of 6.5% or more. Maintaining an A1C level below 7%, 53 mmol/mol, would be a desirable target.
Why is glycated hemoglobin important for diabetic patients?
The glycated hemoglobin is associated with the death rate from any case, acute myocardial infarction, stroke, and heart failure, according to a publication, Roshani et al., NEJM, 2018. When glycated hemoglobin level is about 9%, the hazard ratio was about 1.5 per death from any cause, acute myocardial infarction, stroke, and heart failure. This means that the risk of death is 1.5 times higher when the glycated hemoglobin level is about 9%, 74.9 mmol/mol. Blood pressure and LDL cholesterol were also highly associated with the hazard ratio for the death risk from acute myocardial infarction and stroke. The association between glycated hemoglobin level and heart failure was stronger than blood pressure and LDL in the study.
It seems that the paper showed interesting statistics. Is there any risk factor analysis for acute myocardial infarction?
Yes, they showed the order of risk factors based on the importance of diseases. Glycated hemoglobin level was the most important factor. LDL cholesterol and systolic blood pressure were followed for the patients without coexisting conditions at baseline. But, the gaps of importance between glycated hemoglobin level and the other two following factors were not very high.
Wow, glycated hemoglobin level is indeed as important as LDL cholesterol and blood pressure for acute myocardial infarction. How about a stroke?
Interestingly, glycated hemoglobin was the most important factor for stroke, which was far more important than the second factor, such as systolic blood pressure. LDL cholesterol was not highly associated.
I agree, this is also interesting. Would you let me know the order of risk factors based on the importance of heart failure as well?
Sure, the body mass index was the most important factor for heart failure, which was far more important than the following factors, including glycated hemoglobin level, physical activity, and smoking. Systolic blood pressure and LDL cholesterol were not highly important risk factors for heart failure.
This is striking. The glycated hemoglobin was the second most important risk factor for heart failure. When the A1C level is 6%, what is the estimated average glucose, EAG, level?
The estimated average glucose levels for A1C of 6%, 7%, 8%, 9%, and 10% are about 126 mg per deciliter, 154 mg per deciliter, 183 mg per deciliter, 212 mg per deciliter, and 240 mg per deciliter.
How can we reduce the A1C level?
In order to discuss how to reduce the A1C level, we may think about the reasons why A1C levels can be increased. The glycated hemoglobin levels can be increased by the high concentration of glucose inside the blood, even a few times overeating. Eating saturated fats may also increase blood glucose levels by increasing weight and interfering with the action of insulin. Gaining weight increases the chance of the development of type 2 diabetes.
Aha, avoiding overeating and saturated fats would be helpful to keep the A1C level lower.
Yes, we may talk about how to reduce the risk of various diseases by controlling glycosylated hemoglobin levels later.
Thank you for the interesting information, kind explanation, and exciting plan. Understanding the reasons already gives me a pleasant feeling to grow. If this video is also helpful for viewers, I would like to ask them to subscribe here and watch other related videos. Have a good one. See you soon.